So how do we manage diabetic kidney disease? Managing a diabetic kidney disease is a multifaceted approach. So there are three things which we have to manage. One is prevention or progression of diabetic kidney disease. Second, we have to treat the signs and symptoms of diabetic kidney disease and CKD. And last, we have to treat the complications of diabetic kidney disease with advanced CKD. So how do we prevent? So in the early stage of diabetic kidney disease, because the culprit is diabetes itself, so we have to target the blood sugars and optimize the blood sugar and bring down the HbA1c less than 7.5. There are various drugs which I shown which also prevents the progression of diabetic kidney disease, such as dapagliflozin, that is SGLT2 inhibitors. Next, GLP1 uh, receptor agonists. So that also reduces the blood sugars as well as helps in preventing the progression of diabetic kidney disease. Second, blood pressure. So blood pressure is usually associated with diabetes. It can be a primary hypertension or it can be secondary hypertension to diabetic kidney disease. We have to optimize the blood sugar less than we have to optimize the blood pressure less than 120/80. But the BP has to be individualized and brought down. So the best drug for diabetic kidney disease is AC inhibitors and ARVs. They have been the cornerstone of medications for long durations. There are drugs such as calcium channel blockers like silacardin, which also decreases the intraglomerular pressure and prevents the progression of diabetes. We can use regular drugs such as beta blockers, which also give a cardio. Diet and exercise plays an important role. So the patient in the early stage, we can allow around 1 gram to 0.8 grams per kg of protein. Has to be on low sodium, low saturated fat, low potassium diet, depending on the lab values. This helps in preventing the burden on the kidneys, a lot of stress on the kidneys and progression of kidney disease. Second is regular exercise. Patient has to have to do moderate exercise in the early stage. So as the kidney disease progresses, we also have to manage lipids. So lipid management is also very important. So we have to start on statins, which also have some pleiotropic effect. So this is how one is optimizing the blood sugars, optimizing the BP, especially ACE/ARBs. In diabetes, the drug of choice, the first drug of choice as per the KDIGO guidelines 2022 is SGLT2 inhibitors, but the condition is the GEGFR should be more than 20. And fourth is lipid control. So this is about early stage of diabetic kidney disease. As the kidney disease progresses, once patient have proteinuric diabetic nephropathy, patient will have pedal edema, and in this case, we have to use we have to advise them low sodium fluid restricted diet. Use diuretics. So diuretics can be used to lower the edema. Creatinine starts increasing. Patient can have uremic symptoms, PPIs like pantoprazole and prokinetics. Of CKD. So in advanced CKD, we have to treat complications of CKD. That is, patient will have anemia. So in this case, we see iron and vitamin B12 and treat with iron supplements and vitamin B12 if required. And if both are okay, then we start on erythropoietin. In the early stage of diabetic nephropathy, patient can start having a CKD and mineral bone disease. So we have to start on active vitamin D. So this active vitamin D helps in absorption of calcium. Diet also is very important in this case. This advanced CKD of the stage 3 of CKD, the phosphate starts building up, and as well as there's a decreased absorption of calcium from the gut as well as from the kidneys, and this leads to hypocalcemia. And hypocalcemia will stimulate the parathyroid hormone, and this PTH again causes reabsorption of calcium from the bone, and this patient will have demineralization, and this patients land up in CKD and mineral bone disease. So initially we can use active vitamin D so that there's an increased absorption of calcium from the gut. Second, if there is a hypocalcemia, then we have to treat with calcium supplements. If there is a high PTH level, then we should use drugs such as cinacalcet for secondary hyperparathyroidism. So this is about CKD MBD management. Most of the CKD, advanced CKD, can develop acidosis. So in this case, we have to use oral sodium bicarbonate, which prevents the progression and also helps in the reabsorption, prevents the reabsorption of calcium from the bone. So this is about acidosis. These patients can have dyslipidemia and cardiovascular disease issues. So in that case, also we have to see and treat accordingly. So recent advances as in 2022 KDIGO guidelines as suggested SGLT2 inhibitors as a drug of choice in CKD patients, provided their EGFR is more than 20 ml per minute per meter square. Also advised GLP2 receptor agonist to be used as second choice of anti hypoglycemic agents. They also suggest to start using a mineralocorticoid receptor antagonists such as eplerenone, which where they block aldosterone, and this aldosterone is responsible for damage to the kidney as well as heart tissues. So the KDIGO guidelines suggest to individualize, but they say the target the blood pressure less than 130/80. Lower the blood pressure, it's better. And most of the CKD stage 1 to stage 3 or 4 or 5, we have to vaccinate because they already are immunocompromised. So we have to vaccinate for hepatitis B, influenza every year October, in the October. We have to vaccinate for pneumococcal infections with Prevnar 13 or pneumococ 23. And also we can vaccinate with Shigella for Shigella virus. And if the patient's having recurrent UTI, then we have to put the patient on prophylactic antibiotics. Thank you.